My cycles have always been extremely heavy. Prior to me coming here, I've had multiple surgeries, and I felt like this was my last hope.
Rosalind Harmon was searching for relief from 10 uterine fibroids, causing constant pain, bloating, and blood loss.
Fibroids are muscular growths that occur in the muscle of the uterus, and they begin to grow small early in women's 20s, and then they start to grow larger, usually in their late 30s to 40s.
Dr. John Gray says women with fibroids are often told they need a hysterectomy, when there's actually another less invasive option, UFE, uterine fibroid embolization.
Embolization is putting particles in a vessel and decreasing the blood flow. To do the UFE procedure, we access one of the arteries in the leg and go up into the aorta and then go down into the pelvic arteries that lead to the uterine arteries. And once we get into the uterine artery, we put some particles in that are about 0.5 millimeter in size. We put those particles in until we stop the major supply to the uterus. The best analogy for explaining a fibroid embolization is treating your yard for weeds. You don't treat part of your yard for weeds, you treat your entire yard. So you use a broadcast system where you're spreading the granules all over the yard, and then as they get absorbed into the soil, weeds relatively all over your entire yard won't be able to grow.
Like the weeds, the fibroids can't grow. In fact, the particles decrease blood flow, and over time, the fibroids shrink.
I just reviewed a 2-year follow-up, and the mass had gone from 5 centimeters to 1 centimeter.
The procedure was actually very smooth. It was quick. I came in, the staff was awesome, and that makes a world of a difference because they made me feel very comfortable.
Rosalind says after her UFE, decades of symptoms are disappearing.
I believe it's happening quickly just because of the improvement that I've seen in less than a month with my cycle. I already feel better.